Hi there, welcome to my video entitled Introduction to Brain-Based Therapy, Functional Nutrition, and Metabolic Testing for Treatment of Your Peripheral Neuropathy. It's a long-winded title, but is a long-winded video that's going to provide you with some awesome information. So, if you want to get the most out of this video, what I want you to do is grab a pen and paper, because you're going to be hearing things that you've never heard before. I can pretty much guarantee that. Now, you're watching this video because you've either requested it from an online advertisement you may have seen on the internet. A friend may have given it to you. You may be a patient in my practice already. But basically, I have created this video because we have a groundbreaking way to help people who have been suffering with peripheral neuropathy. So, a little bit about why I'm doing this. About a year ago, a patient of mine, an acupuncturist, came into my office and he brought me a book called Why Do I Still Have Thyroid Symptoms When My Lab Tests Are Normal? And although this is a thyroid book, this book is really for anyone who's been suffering with chronic fatigue, any type of chronic condition, peripheral neuropathy. And myself, I had adrenal fatigue, and this is where you're tired all the time, you have some brain fog, can't sleep, you crash in the middle of the day. And when I read this book, a light bulb went off as to why I was suffering with adrenal issues. And then I realized that really all the patients that I see in my practice, they may come in with neck pain or back pain. And 20% of the time they have a neck pain problem or a back pain problem. But more often than not, it's 80% of the time they have something else that's going on. And that's what I wanted to discuss with you today with your peripheral neuropathy, is the fact that 20% of the time it may be just a peripheral neuropathy problem, but really 80% of the time there's so many other things that are going on, and you're probably sick and tired of just taking another pill, another tonic, or another prescription, only to have to go back to your doctor and get another one because something else started. Like you took this pill for blood sugar issues, then you started having headaches, then you started having blood pressure. So it's just, you want to get out of that rat race of taking medication so that you can finally recover and do the things that you want to do. And that's what my video is about today. So a little bit about myself. My name is Dr. Joel Rosen. I am a practicing chiropractic physician, but I'm a lot more than that, because after reading that book, it sort of turned the light bulb on for my head to continue with my continuing education credits. And so I've enrolled in something called Functional Medicine University. This is an awesome program to teach you about the biochemistry and the physiology of the things that go wrong in your body and how you can fix that, as opposed to just taking this or that. I'm also studying functional blood chemistry and functional endocrinology by Statins Karazin. He was the author of that book that I just showed you. He put seminars across the country on how to learn about gluten issues, neuropathy issues, thyroid issues, neurotransmitter issues, and they're awesome information. I've also studied under Michael Johnson. He's the author of this great book called What Do You Do When Your Medications Don't Work? It's a non-drug treatment to dizziness, migraine, headaches, fibromyalgia, and other conditions. If you can, grab this book. It's a great book for you to get a lot of information about. So I've studied under him. I've also studied under Apex Energetics. Those are the seminars that go across the country each year, a couple times a year. I also have an undergraduate degree in exercise physiology and psychology. And lastly, I have just finished it's actually not currently enrolled. I need to change that. I've just graduated from something called the American Functional Neurology Institute. We're going to talk a lot about neurology and how it relates to your peripheral neuropathy. And I want to just let you know, if you were to have to turn this video off right now and you didn't want to watch it anymore and I'm too boring, I want you to learn three main things that you're going to get out of this video. Is number one, your body has the ability to heal itself. This has been proven in research over and over again. You can just go on the internet and Google that. Your body really has all the tools it needs to heal itself, provided that it's given the right environment. Number two is 80% of your immune system is in your gut. And if your gut is functioning optimally, then that's going to allow your body to heal itself. Things that will cause your gut to not heal optimally or work optimally are autoimmunities, anemias, blood sugar dysregulation, inflammation, so many things that are going to cause our body problems, and this can manifest in your case as a numbness, tingling, burning in your feet. And then lastly, the neurology part of it is your brain, your central nervous system, your spinal cord is responsible for all the functions of your body. So if your metabolic issues or your gut issues are working optimally and your nervous system is working optimally, then your body has the ability to heal itself. And that's what we're going to teach you today to learn how to do. And so that's a little bit about me. So let's talk about peripheral neuropathy. What actually is peripheral neuropathy? Well, peripheral neuropathy is a problem with the nerves that carry information to and from your brain and your spinal nerves. This can produce pain, loss of sensation, an inability to control your muscles. This is a huge, huge problem. And if you're watching this video and you're older than 65, this could be life-threatening. And the reason that is because when you're older than 65, it's known that the greatest cause of death is falls and traumas from falls. And so if you're unable to feel your feet because of a peripheral neuropathy, then you have a real risk of falling and maybe breaking a hip, or even worse, hitting your head. So this is a really important point about peripheral neuropathy, is getting the sensation back into your feet. Peripheral neuropathy is a huge epidemic. In America, I believe there's over 20 million Americans that have this. Peripheral neuropathy, or nerve damage, disrupts the body's ability to communicate with the muscles, skin, joint, and internal organs. It's like the body's electrical wiring breaking down, causing numbness, pain, weakness, and poor coordination. So if we just think, we'll talk more about the nervous system and the peripheral nerves and the spinal nerves and the central nervous system, but basically it's a default in your nervous system conveying messages back and forth. And so we need to explain why this has happened, as opposed to just taking a pill and taking this to help with the symptoms. We actually want to figure out the cause of this and go back upstream to figure out how we can fix the cause. So, the word peripheral neuropathy, peripheral means from the distance or from away from the center of the body, and neuro means nerve, and pathy means a problem. So if you think about it, it's a problem with the nerves from away from the body. And that's really what it is. We have the nerves that go everywhere in our hands and our feet, but they also go everywhere to our organs too. So if there's a problem with the neuropathy, wherever those nerves go to and communicate with, you're going to have manifestations of problems. So this is a huge, huge problem, and more so than you really think, which I'm going to get into. You may be thinking all you're having is a feet or tingling issue, but really you don't. You have a lot more going on, and deep down you probably know that. So it's time to really get some more information. So I want you to write this down if you have. 7 signs of peripheral neuropathy. The first one is numbness. I mean, that goes without saying. So numbness is I don't really feel my feet. I sort of have to look down to see where they are. And that's when you get people that are looking down and they start walking forward, is because you can't feel your feet. They're numb. So I don't think you need any elaboration of that. Number 2, burning feet. These are when the nerve endings are deafferentating, which means your large diameter afferents, they're the part of your nervous system that send information to your brain about touch, about discriminating vibration, about knowing what's going in. And those are also the most heavily myelinated. So that means that they have the most nutrition around those nerves. So when your nutrition or your myelination is becoming altered, then you're not going to have that same sensation going to your brain. And that's when we have burning pain, because that burning is sort of a disruption of that sensation fiber. So you know that that's a stage in which where you're losing the sensation of your feet and your neuropathy is starting to get out of hand. The next one is cramping. We're going to explain there's different functions of the nerve. This is more of the motor component of the nerve, meaning the contraction component of the nerve. But ultimately, if those are starting to break down, then the motor component is going to result in some cramping of those feet. And it feels like they almost get locked up. The next one is a sharp electrical pain, somewhat similar to the burning pain, but the sharp electrical pain is like it says, it's sharp. It's like stabbing and daggers and little electric currents just sort of going off. That's a little bit different than the burning pain. So if you have one or all, you could have one of these, you can have all of these, but if you have one of them and I haven't mentioned it, more often than not, it's still classified under the neuropathy symptoms. Then we have pain when walking. So that's just pressure on the pain. The neurovascular junctions in our feet, they're getting swollen and inflamed and irritated, and you're causing pain when walking. You don't even feel like walking because you can't feel your feet. It hurts, and you're not doing the things you want to do. You're staying home. You're no longer going out and traveling. You're running from one doctor to the next, and your life kind of sucks, and you're wanting to get some more results than what you've been getting. Then we have difficulty sleeping from leg discomfort. I've heard this term restless leg syndrome, and to me that's more of a symptom of a greater problem, namely that you can have a lot of medication going on in the body, and that's creating neuropathy. But basically you have like this leg pain that just won't go away, and that's a good name for it. It's a restless leg syndrome, and that's where it's just a nuisance. And then prickling, tingling feelings. This is almost, I kind of explain this as if you stuck your finger into an electrical socket, you sort of feel that tingling or the numbing. It's sort of similar, but all of these are similar, and these are the 7 signs of peripheral neuropathy. So the symptoms will depend on what type of nerve is affected. So we were talking about that a little bit earlier. Basically, we have 3 components to the nerve. We have the sensation, which is telling us what's going on from the outside, vibration, pain, temperature, discrimination, anything that's going to cause a sensation to our brain of what's going on. We have the motor component. So this is the part of the brain that sends information down and causes the nerves to contract or to know where we are and to balance. Those could be affected. And then we also have what we talked about, the autonomic. These are what are the nerves that go to parts of our body that we don't control. And that's a scary thought. If you're getting problems with the traveling of the nerve impulse to a organ system, a gland, then potentially you're going to have a metabolic concern, which we're going to get into in a couple moments here. So what happens with the sensory changes? We talked a little bit about that earlier. This is when you're going to get the burning, the nerve pain, the tingling, the numbness, the inability to tell if your foot is going up or down. I mean, when you come in and I do an examination with you, basically I do a test, an awesome neurological exam, and one of those tests is called two-point discrimination and joint position sense. So joint position sense, what I'm going to do is I'm going to grab your toe from the outside, and we're basically going to go up or down. And you're going to tell me as soon as you feel it, go up or down. You can't believe, I'll have patients that I put their toe almost like I feel like I'm going to break it. And when that happens, I know that they have lost their sensory component in their toes, and we need to wake those back up. Neuropathies changes begin in the feet, and then they progress upwards to other areas of the body as the condition worsens. And we're going to get into diabetes, but diabetes is certainly one of the main causes. And when you come into my office, we're going to have to evaluate you for diabetes, and that's going to be one of the things that it's really, really easy to help. I know all these drug companies say you need to take this pill or that pill, but really there's so many great homeopathic and just lifestyle changes that you're going to have to make. And that's what I'm going to say to you right now. If you're watching this video and you're looking for an easy solution, you should probably just turn this off. And what I mean by that is that it's going to take some hard changes in your life for you to get back the sensation of your feet. That doesn't necessarily mean you can't. It just means if you're not ready to make some lifestyle changes and be serious and taking control of your health, eating healthy, maybe coming in several times to get your feet woken up, to take the pressure off the spine and the joints, to do some brain rehab therapy, it's going to take some effort. And it's just not Jack and the Beanstalk, get these magic pills, go to bed, plant them before you go to bed, wake up, and the beanstalk's there, and you have a pot of gold at the top of it. It's not going to work that way. You're going to have to put some effort into it. But I'm sure you're wanting to because you're watching this video. The next thing is movement difficulty. So the other part of the nerve that can be affected is the motor component. The motor component is when we have atrophy, muscle bulk is lost, dexterity, balance, cramping. So if you're getting this, then you know it's not only the sensory component of the nerve, but it's also the motor component of the nerve as well. So one thing I want to talk to you, this is probably the most important slide I have on here. But basically this most important slide talks about you're not coming in with just neuropathy. I can pretty much guarantee that. You said I said earlier in the video, 20% of the people coming in are coming in with just neuropathy. Really, with a neuropathy patient, it's usually 95% are coming in with other things. And the other things could be obviously the neuropathy, the thyroid problem, insulin resistance. We're going to talk about that, which is called metabolic syndrome. What's basically happening is your cells are no longer listening to insulin, and then that creates high cholesterol, high triglycerides, high fatty acids, and then very little energy into the cells. Fibromyalgia, vertigo, sciatica, chronic fatigue. Besides sciatica, I'd even put stenosis, rheumatoid arthritis, chronic neck and back pain. We actually have stenosis here. IBS, so difficulty with gastrointestinal inflammation. Insomnia, you're not sleeping. Crohn's, celiac, infertility, migraine headaches, ADD, ADHD. So these are all things that could be going on as well as your peripheral neuropathy. And one of the things that I want to talk about is why do these things have common threads? Or a lot of these symptoms are very similar in terms of what went wrong. And what went wrong is basically metabolic imbalances, anemias, not having enough red blood cells in your bloodstream to supply oxygen. And when your nervous system is not getting fuel and oxygen in the way of sugar and O2 or oxygen, then they're beginning to fatigue and die off. Chronic inflammation, we'll talk about that in a second. Unstable blood sugars. If you're having a dysglycemia or you're not getting optimal blood sugars into your cells, then basically you're going to have unstable blood sugars. Adrenal gland dysfunction. This could be injuries, this could be stress, this could be also infections. That's going to cause our adrenal glands to go haywire. Hormonal imbalances. As we get older, we know we don't have the same amount of testosterone, and then we fatigue, and then this could create inflammation in our body. So I'm going to sort of put this puzzle together and explain to you what no other doctor has ever told you, and trying to tell you that really your neuropathy is not just a problem with the numbness and tingling in your feet. It's potentially chronic inflammation, anemia, hormone problems, autoimmunities. Autoimmunities is huge. One of the things I tell people about autoimmunities is the fact that think about termites destroying the house from the inside. That's basically what happens is your own immune system has created so much chaos that it started attacking different tissues in your body. Food sensitivities. Initially, patients come in and tell me that they have problems with milk or gluten, and that's a real problem. But it could also be more than that. It could be coffee. It could be rice, potatoes, corn. And how do you know? I mean, how do you know these are the foods that are creating inflammation in your body and creating the neuropathy in your feet? Also, low oxygen. So huge. And then we have the neurological imbalances where we have a decreased rate of firing. So I'll get into that right now. So basically, I've put on my shirt here, neurometabolic, and that sort of prefaces what I talked about at the beginning is if you think about the triangle, your body has the ability to heal itself from any illness, provided the right environment is there. Number two, your 80% of your immune system is in your gut. Really, that's talking about metabolic concerns. And then number three, your central nervous system controls your entire body. That's why I have this neurometabolic care, because you can have a relationship between when you're not getting enough fuel, sugar and oxygen, you have a lot of inflammation in your body, then what happens is it's not providing the right nutrition to the neurological side of it, and then your brain starts firing off balance, not firing the way it should, and when that happens, then you have a breakdown, and in your case, you're getting neuropathy. So doesn't it make sense for you to focus on everything that's causing the problem and trying to fix that? I think it does. So I usually say 60% of it for a neuropathy patient is neurologic, 40% is metabolic. And if we're going to help you 100%, then we need to be able to work on both of those. So let's talk about how we do that. So in general, metabolism, I want you to write this down. You hear the word metabolism. Well, I have a fast metabolism. I have a slow metabolism. You know, people that can eat as much as they want and they still stay lean. That's considered a fast metabolism. Or people that hardly eat any food and then they gain weight. That's a slow metabolism. But in general, a really easy way to know about what metabolism is you eat food and it converts it to energy. That's a metabolism. So whenever it's like a gas, putting gas in a car and then letting it run. That's the metabolism of the car. And one of the questions I want you to know to drive home how important metabolism is to our nervous system, 30% of energy goes to what system? It goes to our endocrine, our digestive, our nervous, our immune, our cardiovascular. What's the answer to that? The answer to that is our nervous system. So our nervous system alone requires 30% of the fuel that we get in our body. And if we're not getting adequate amount of fuel, then obviously our metabolism is delayed and it's not providing the vital nutrients that we need for our brain to function optimally. And all right, so we talked about that. So neurologic and metabolic causes of peripheral neuropathy. How does these things that we just talked about, how does that relate to our peripheral neuropathy? Number one, statin drugs. You're probably on a statin drug. Don't even get me started. I have another 2-hour video on cholesterol medication. But either way, it's the standard of care in the United States here of taking cholesterol lowering medication. You know, you may be taking that because your cholesterol got too high, and that points to a good fact of having to get out of the standard American diet and changing some of the foods that you're eating. But cholesterol also is very important. But either way, statin drugs is a huge problem. We're going to go into that in a second. Brain imbalances, again, we'll talk about that. Back issues. You know how many times I get a patient coming in here who says, I have a bad back, I can't feel my feet, and there's a lot of overlap. So when you have a bad back, you need someone to focus on that bad back, and I have an awesome therapy protocol in this office to help you with that. But that could lead to scar tissue, narrowing of the canal. Think of narrowing of the canal sort of like a nut and a bolt, and the bolt won't go around the nut won't go around the bolt, so it's stuck. And that's what happens as our spinal cord gets too thick, or the narrowing of the canal gets actually too small for the cord, and then that's when we have heaviness in our feet. So we need to focus on that. No medication is going to help you with that. Bulging discs, wear and tear, gravity. We start having postural problems. We need to fix that. Type 1, type 2 diabetes, insulin resistance, poor diet again, thyroid problems, adrenal gland problems, chronic inflammation, food sensitivities, hidden infections. Hidden infections are huge. We do a lot of muscle testing in our office to determine where the infection source would be, and we have awesome protocols for that as well. So let's talk about statin drugs. They obviously inhibit the formation of cholesterol, but however, they also inhibit the formation of CoQ10, which is a necessary enzyme for energy production. Energy production, again, is our metabolism. So if we have a draining of our coenzyme Q, which is necessary for energy production, then that's going to be a draining of our metabolism. And then that's going to create fatigue. So human abilities are able to make ATP, but it decreases about 1% per year. Just the fact that we're getting older, our metabolism decreases. However, the fact that we're also taking statin drugs, our metabolism increases. So that's a huge problem, which I'm going to talk about. Taking statin medication can also suppress the production of ATP to the point where the neurons or the nerve cells can no longer maintain their electrical gradient, which means they're getting sick. They're not firing, they're dying quicker. The FOF, the frequency of firing, how fast they fire, will decrease, which means you'll have, so pain fibers are chronically being stimulated. They're no longer able to get down to resting potential, and then that way your feet are always numb. Awesome study that was done in the Journal of Neurology in May 2002 that says that statin cholesterol drugs increase the risk of peripheral neuropathy by 16 times. That's 1,600%. Now, I'm not able to tell you to get off the statin drugs, but what happens if we are able to help the metabolism, help your insulin resistance, help your blood sugar dysregulation, get rid of chronic inflammation in the body, get rid of infections in the body, help the adrenal glands. All of a sudden, your metabolism is increasing, your energy production is increasing, and you may not need you may go see your doctor and ask them if that's something that they can think about getting off the cholesterol-lowering medication. So basically, we talked about it blocks the CoQ10 pathway. And if you don't get anything out of this video except this, is you should be on a CoQ10 supplement every day, 200 to 600 milligrams. Now, I recommend you go with really good supplement sources, know where they're from. We use a lab called Premier Research Labs. Basically, what they do is they don't put any fake crap in their supplements. So excipients, tag-alongs, powders, chalks, fake stuff, basically. These are things that if you got to figure out. CoQ10 is a food source. It's an enzyme, and you want to get it from live sources. And if you're getting it from manufactured in a lab and you got to produce it into a little pill, you got to put binders in there, fillers in there, and you're not getting the digestion and absorption you need. So we sell that in our office as well. Statin drugs increase the risk of peripheral neuropathy damage from 1,600 to actually 4,500. So that's a huge problem. All right, so proper testing for peripheral neuropathy, proper treatment for peripheral neuropathy. We talked about the CoQ10. That's a great supplement for you. Correct nervous system abnormalities, we're going to talk about in a second. Diagnose metabolic conditions, anemia, blood sugar, insulin resistance, poor diet, immune imbalance, thyroid condition, inflammation. We do that through functional medicine, which I'm going to talk about. And we also remove the pressure on the lower back, and we wake up the nerves. So let's talk about the nervous system now. The nervous system controls and coordinates all the systems of the body. I talked about that earlier. And it also relates the individual to their environment. That's straight out of Gray's Anatomy. That's what the nervous system does. So the nervous system consists of your brain, your spinal cord, and your nerves. Your brain's like the master computer of the entire program, and then your nerves are the communication cables. And each cell is dependent on both those things to optimally function. So let's talk about the brain and the body connection. Your brain is basically one big sensory organ. So it senses information from the outside, and it starts to process that information and what to do with it. Your body is the big receptor. We have receptors in our body that sense touch, that sense vibration, that sense pain, that sense temperature, that sense vision, color, smell, hearing. I mean, all these sensations go into our brain. Our brain is the receptor for that. The brain stays alive from all these receptors. So if we didn't have these receptors stimulating it, the brain wouldn't stay alive. Which are the two biggest receptors that our brain stays alive with? Are actually touch and gravity. So gravity is always stimulating our brain to process the information and keep it alive. Three parts of the brain are the cerebellum. Cerebellum is responsible for eye movements, for accuracy, for balance, coordination. The problem with peripheral neuropathy is the fact that there's going to be some cerebellar concerns in this fact that you can't feel your feet, you're going to be off balance. So what we do in our office is we do some awesome neurological testing to test the integrity of your cerebellum. We check out your eye movements, we check out your coordination, we check out your posture and balance, and if we find any deficits, maybe your left cerebellum or your right cerebellum aren't functioning optimally, then we need to do some therapies to bring that back online. And that stuff is life-changing, I can guarantee you that. We also have the cerebrum, that's also the brain. That's basically where we have the frontal part of the brain for cognitive thinking, eyes, vision. We also have the parietal lobe for sensing our body, knowing where everything is. And if there's any problems with that, then obviously it could manifest in peripheral neuropathy as well. And then lastly, the brain stem. This is where all the cranial nerves are located. We could have decreased fuel and activation, and that will create smell, memory, lots of different visual sensation, and that's what we're talking about with our feet again. So how does the brain work? Sensory information goes from the body to the cerebellum first. And then the cerebellum basically sends it to the other side of the brain, the temporal lobe, the occipital lobe, and then the upper brain has connections down to our brain stem, and then the brain stem inhibits the nervous system, like putting the brakes on. And if we didn't have the optimal ability to put the brakes on, then we're basically going to spiral out of control. And these are things that you don't necessarily see on an MRI, or you go to the neurologist, and your neurologist basically tells you, basically what I've heard is the neurologist, medical neurology, tells you about STDs. And basically they talk about stroke, tumors, and then basically dementia. But if you don't have any of those, then you're told you're fine. But meanwhile, you have a metabolic issue that's created a diminished brain activity, and that's resulted in neuropathy. And it's easy stuff to rehabilitate. All right, so we can have an overfiring nervous system, central sympathetic nervous system, which will cause chronic pain, irritable bowel, urinary tract infections, fibromyalgia, migraine headaches. So you may also have migraine headaches. And now we're trying to link and we're trying to get together the idea of what happens when your neurology isn't optimally functioning. We could also cause blurred vision, sweating, difficulty falling or staying asleep, dizziness, heart palpitation, cold hands and feet, sensitivities to light and sound. So all these things could be a result of the fact that our brain is not optimally functioning. Cerebellum fatigue, loss of balance, vertigo, chronic neck and back headaches, clumsiness, dropping things, disorganized thinking, bad handwriting, a lack of output from the upper brain to the parietal lobe, to the frontal lobe. So these are all things that are going to manifest. All right, so upper brain fatigue, let's talk a little bit about that and then we'll move on. Depression, difficulty scanning pages, difficult adding and subtracting, verbal expression, decreased memory, learning deficits, lack of focus. Nowadays, the new buzz in healthcare is brain work. There's a program called Luminosity. You may have heard of it before. It's basically trying to stimulate your brain. And that's a great start. But if you don't focus on why you need to stimulate your brain and how this started in the first place, then you're only doing half the puzzle. Let's go into, so how does all this happen? Why does the brain start to break down? The reason this is because chemical stress. There's so many environmental pollutants, smells, chemicals with cleaning supplies, chemicals all over the place, plastics. All of these can cause problems. Physical stress, just gravity pulling us down, trauma, repetitive stress from a job or from something that you're doing all the time, emotional stress. All these things are going to cause fewer nerve impulses to our brain. Chemical stress can also be the physical stress, blood sugar imbalances, food sensitivities. Now let's talk a little bit about that. Food sensitivities. We have gluten sensitivities, milk sensitivities, soy sensitivities. All of these things are going to create inflammation in your body. And then you got also prescriptive drugs. All of those can create deficits to the brain. Chronic inflammation. Inflammation is sort of like a blowtorch. So imagine me having a blowtorch and blowtorching this screen here. Obviously what's going to happen is I'm not going to be able to see that very well. So if I have inflammation in my brain because of inflammation in my body, the blood supply brings it up to the brain, and then all of a sudden all those things that I just talked about before, your cerebellum, your frontal lobe, your parietal lobe, all of those things aren't optimally functioning. And in your case, you're getting peripheral neuropathy amongst other things, amongst all those other things we talked about as well. Emotional stress can create problems with the adrenal glands. So our adrenal glands are our stress-fighting organs. So if I'm stressed or I get held up at gunpoint, then what's going to happen is I'm going to have my adrenal glands secrete cortisol to try to help regulate my response to stress. When that happens, that's going to create my blood sugar levels to go too high. That's going to create insulin sensitivity, and then the next thing you know, I'm going to have high triglycerides, LDLs, cholesterol, stuff like that. And that we need to fix that. So how do we know if we have these? How do we know if we have anemias or blood sugar dysregulation or food sensitivities or immune problems or adrenal problems or hidden infections? Basically, it's the proper testing. And I can pretty much guarantee that you have papers and pages and books of testing. And nothing has ever told you what's going on to the extent that I've been telling you. And so what is going on is that you've done testing, but you may not have done the proper testing, or you may not have looked properly at the testing. Just think of it this way. Medicine these days is a broken model. And we know with Obamacare and with the lack of coverage and the lack of proper health care, the fact is that we're not getting the type of care we need, and doctors have less and less time to spend with us. I know for a fact that in 1995, Medicare was paying more than they're paying now. However, I'm also now 18 years later, paying more for rent, for overhead, for power, for salaries, for whatever. And I have less reimbursement dollars from Medicare. So what does that tell you? It tells you that I have less and less time to be able to spend with you. A lot of questions I get, which I was going to save to the end, but I'm going to tell you right now, is that insurance pays very, very little for what I'm doing here. They may pay a little bit for some of the procedures that I do in my office, but the testing and the brain-based therapy and some of the spinal decompression and the rebuilder is they pay very little. And I wish they paid more, but they don't. So I'm just going to tell you right from now, if you want quality care for your chronic condition, you're going to have to come out of pocket. The good news is that I've made my care very affordable, and I get to the point now where if someone tells me they can't afford it, that may be the case, but that tells me also that they're not serious about getting their condition better. And if you are serious about getting your condition better, then you'll do what it takes to get better. Enough about that. All right, so what are some of the blood testing that we do in our office? We do the blood chemistry panel, but most importantly, we do thyroid markers. Those are super important. Antibodies to your thyroid stimulating hormone or your thyroid binding globulin. Those are very important markers to know if you have any type of autoimmunities, and I never ever see them done. A1C, I'm sure you've had that. That should be below, I believe, 5.7. That's what that should be below. And where are you on that? And we need to fix that. Lipids, CBC, salivary hormone testing. Those are awesome. That's a saliva test that we measure we can do your male hormones, we can do female hormones, we can do adrenal testing to test the cortisol levels. We do that in our office. Stool ecology, hidden infections, parasites, H. pylori, bacteria, viral infections. We do that as well. Have you done any of these? If you haven't, then you haven't been properly worked up. Food sensitivities, gluten, eggs, soy, yeast, milk, dairy. We do all of this in our office. Also, leaky gut. The best way I can explain leaky gut is think about a fine metal strainer. When you have pasta and you're boiling the pasta and you put it in the fine metal strainer, all the water drips out. That's what we should have in our gut. It should be really, really coarse and should filter everything that goes into the bloodstream. However, over time, that fine metal strainer turns into a colander. And now you pour that pasta in there and the pasta flows through as well as the water. That's what a leaky gut is. And when that happens, that creates inflammation in our body. And we talked about what happens with inflammation in our body. It goes to our brain, causes cerebellar issues, causes brain issues, causes brainstem issues, sympathetic problems, headaches, dizziness, balance concerns, neurologic concerns, breaking down of the nervous system, not being able to feel my hands, having numbness, tingling, burning, difficulty, pain with walking. I hope all of this is sort of tying together now, and you're kind of like thinking a light bulb is going off and saying, yeah, it kind of makes sense here. It's all related. We also do an autoimmune test. These are tests that we can go over in our office. Here's an awesome slide. Have you been told your tests are normal, but meanwhile, they're not necessarily, you still feel crappy? That's because the fact is there's a difference between lab ranges and functional ranges. Let me explain. Lab ranges are a narrow, tight-knit range, whereas laboratory ranges are wide. And so it's kind of like I have 11-year-old twins now, and I explain this to my patients is think about lab ranges as you're getting an F in your courses. Think about functional ranges like you're getting a C in math. And so what happens is with the laboratory ranges, they wait to the end of the year, wait till you're failing the course, and then say, hey, you're failing the course, we're going to give you some extra study now, or you're going to have to take that course over. The analogy is now that you're so far out of your range with your blood tests, we're going to give you some medication now. Doesn't it make sense to try to start filling in the problem before you start failing? So wouldn't it make sense to give my kid extra studies or extra help or extra homework while they're still getting a C to bring their grades up? That's what a functional range is you can still have symptoms. You could still demonstrate to your teacher by getting a C that you still don't know the material. But meanwhile, you're waiting till you fail before you start to get some kind of remediation. And that's what functional ranges are. Is why it just doesn't make sense to me is why a doctor will say you're normal, meanwhile your functional ranges are showing that you have too low or too high from a healthy point of view, and you're not doing anything to fix that. Some examples of that are glucose. Glucose 85 to 100 is the functional range. Traditional ranges are 65 to 110. TSH 1.8 to 3.0. Traditional ranges are 0.3 to 5.7. So see how much wider it is? Cholesterol 150 to 200. They're telling you now you should be below 200. In fact, I think functional ranges are 220. So you can see 13.5 to 14.5 for hemoglobin A1C. It says here 12 to 16. I'm going to have to make sure on that one. All right, so what are some of the things that we do to try to help you? We alter your diet. We remove things from your diet. We have the research labs that I was telling you about earlier that we're going to try to do to help get the body functioning optimally. Improve your insulin resistance, support your adrenal glands, improve your blood sugar levels, support your nerves to regenerate. We have something called the rebuilder. Support the thyroid gland if we find something there, and most importantly, support the brain function. We have brain-based therapies in our office, and as well, get the inflammation to go away. So what is brain-based therapy? What do I do in my office? So brain-based therapy in my office, let's go over that. All right, so the brain needs two things to optimally function. It needs fuel and it needs activation. Fuel in the terms of glucose and oxygen, activation in terms of proper brain exercises. And that's what I want to talk to you about. All right, All right, so in different offices, you can do oxygen therapy. We don't do it in our office because we're not allowed in the state of Florida to use oxygen. But an oxygen concentrator is used to help stimulate the fuel to the brain in the way of oxygen. Vibration therapy. So we do a lot of vibration therapy with a percussor to stimulate activation to the brain. We do gentle neurologic adjustments. We do warm water calorics. We do balance therapy. We do muscle retraining. We do auricular therapy. We do smell sensation. Rebuilder. Okay, I wanted to talk to you about that. Rebuilder is frequency at 7.8 hertz, and we wear these gloves and we put your feet into a foot bath, or pads on your feet, and those will wake up the nerves. It's found that our nerves' ideal resonant frequency is 7.8 hertz. What that means is it's going to wake up the nerves in your feet and your hands so that you can feel them again, as opposed to the normal TENS unit that closes it down and blocks those channels, which is already blocked, so you don't need that. Spinal decompression. We do spinal decompression in our office using the DRX 9000 for the neck and for the back. This is a basic, gentle therapy to take up to half your body weight off your lower back, thereby taking pressure off the discs, helping with stenosis, helping with nerve flow, being able to feel your feet again. And we also do cold laser therapy. The other thing I should add is we do infrared therapy. All these therapies are going to help with inflammation and help your metabolism and help regenerate those nerves and get you back to your life again. Visual stimulation is to try to stimulate different areas in your brain. Auricular therapy is to try to stimulate the canals in your ear to help with the sensation to your brain. Spinal decompression looks like this. So basically, we need to put the puzzle back together again. The cerebellum, the cortisol, the oxygen, the sugar dysregulation, the hormones, the midbrain. We need to get that back together again so that these metabolic issues are creating a synergy effect of healing. So what's next? You've watched this video all the way to the end, and I want to reward you for doing that. I appreciate that. I hope you found it very valuable and interesting. If you know of anyone else who suffers with neuropathy, at least give them this video because you're going to get a lot of information out of this. What's next is I offer you guys a 2-visit consultation and report of findings. In the visit 1, we do a complete neurological evaluation. This is an awesome neurological evaluation. Basically what I do is I test your large diameter afferents, your vibration, your 2-point discrimination, your joint position sense, your pinwheel. We do also reflexes. We do balance, eye movements, finger to nose, Romberg's. I guarantee that you've never had a test done like this before. This is smells, cranial nerves. We'll be able to tell where the deficits in your brain are and where this has resulted in a problem. We also review your existing labs. So before you come in, you need to fax that over to me so I can take a look at it. You'll call my office. I'll get you to fill out a metabolic assessment form. It'll give me an idea. Do you have any problems with the colon, with the barrier systems, with the leaky gut, which we talked about, with the small intestine, with the stomach, with the gallbladder, with the adrenal glands, with the blood sugar levels, with the thyroid. So I'll know before you even sit down and do my neurological exam that you do have a web of physiologic dysfunction. You don't just have neuropathy in your feet. You have gut issues, you have adrenal issues, you have blood sugar issues, you have potentially past tests that can reveal things on there. You also should be with your spouse. The reason is because your spouse needs to see how serious your problem is so that you can take the proper steps to get yourself better. I don't want me to spend all my time with you, go over everything, present to you a care plan, and then tell your spouse that, oh, I can't kind of remember exactly what it was. So you need to bring that spouse with you. If I accept your case, visit 2, I'll let you know that. I don't accept everyone's case. There may be things that I can't help, and I need to determine if you're the kind of patient that I think I can help and that I want to work with. To be honest, I don't want pains in the butts. If you're going to give me a tough time, I'm not going to want to work with you. If you're willing to jump through hoops and to do what you need to do to get better, then I think I can be able to help you. So we'll go overview everything that we do. We'll go over the neurological assessment, what we found, and I'll give you my best recommendations on what I can do. And if you can't afford my best recommendations, then I'll work within your financial means to see what I can do to help you. Here's the thing. I only do 5 new patients per month. I have a busy practice. I see a lot of other conditions. I see spinal decompression. I see thyroid issues. I see IBS and Crohn's. I see people who've been involved in motor vehicle accidents. So I only have 5 new patients that I can take per month. Usually I charge $450 for these 2 visits. I give you a lot of my time. However, because you're watching this video, it's only going to be $60. I want you to call my office at 561-883-0090, and you tell David that you just watched my video and that you want to come in for the peripheral neuropathy neurological assessment with the findings, I'm actually going to do one more thing. I'm going to include my first 2 visits free. So what that means is I'm going to do whatever I would do to you if you were a paying patient and you accepted my care. That means if you need spinal decompression, I'm going to do that. If you need rebuilder, I'm going to do that. If you need some brain-based therapy, I'm going to do that. I'm going to do everything that I would do had you accepted my care and went forward. So you can test drive and see exactly what it is that I do. However, there's 3 rules that I go by. You must be willing to make a serious change. Whatever you've been doing hasn't been working. You've been going to the doctor, you've been trying to maybe exercise, but you're still suffering. And so you got to continue to persevere and make some serious changes and some serious sacrifices. Number 2, you have to take accountability for your health. So your insurance is not responsible for your health. I tell patients, you have car insurance, but it doesn't pay to get your gas in your car. It doesn't pay to go to the mechanic. It doesn't pay to get your car washed. However, you thought getting gas for your car was important. You thought that getting the transmission fixed or the brakes fixed or the alignment fixed was important. You thought that getting the car cleaned was important, yet your insurance didn't pay for it. And that's the same thing with this, is that it's the is world versus the should be world. The should be world is insurance should pay for this. It really should. I wish it did. However, it doesn't. And it may pay a very little bit of a portion. And you yourself are responsible for getting your car washed, fixing your car. You're responsible for fixing yourself. And I'm pissed off when I see patients that aren't willing to do that. I'm sorry to get upset with this, but sometimes I think if I would have been a mechanic or I would have been a plumber and I would have told you that your car's broken or your toilet is backed up and that you needed to get it fixed, you're not going to say, oh, well, I'm going to think about my insurance, got to see if my insurance is going to pay for my toilet. You have to pay for that. You have to pay for the car. You may have a warranty, but unfortunately, bottom line is you need to take accountability for your health. Lastly is Medicare and insurance pays a very small portion, but I've made my care affordable to 96% of my patients that come in here. If you can afford $150 to $300 a month, then you can afford my care. I can also potentially do a prepayment where we give you significant discounts on whatever I do. But come on in, $60, get my 2 free visits, go through a test drive and see what I have to offer. I want you to lastly think about, on a scale of 1 to 10, how serious are you about your problem? If you're not an 8 out of 10 in how serious your problem is, I'm glad you've watched this video, but it's probably not for you. This is for people that are not living the life they want to. They're not going out, they're depressed, they can't feel their feet, they could shake you on their feet. Your life sucks and you know it, and you want to get better. Where do you see yourself in 3 years if this doesn't get better? You know, the definition of insanity is doing the same thing over and over and expecting a different result. What are you going to do in 3 years if this hasn't gotten better? How has this affected your loved ones, your work, or if you're not working, your friends, your spouse? I mean, how pleasant are you to be around based on the fact that your life is on standstill? Think of 3 things you could do think of things you could do if you didn't have peripheral neuropathy. What is it that you want to do? Don't you want to do things? Don't you want to travel? Don't you want to be active? Don't you want to get out and do things socially and get your life back? I mean, that's what we're talking about. So on a scale of 1 to 10, if you're not serious about eliminating your problem, then please don't come in, because I'm a busy guy, and I don't want you to take any offense to this, but I don't want you to waste my time. Lastly, I want to thank you for watching this video. It was a long video. Hopefully you found it informative. If you have any questions, please call me. You can email me at drjoelrosen@yahoo.com. But really, this video was about the kicking the tires. This video was about information gathering. That's why I do this. I can't explain to you guys everything I do because it takes a long time. And even what I did today doesn't explain all what I do. That's the information that you're getting today. Call me, let me do a neurological examination with you. Let me give you 2 free visits. Let me give you a report of findings and explain to you how I'm going to be able to give you some significant relief on your peripheral neuropathy, and I look forward to doing that. Hope you found this video exciting. My name is Dr. Joel Rosen, and I look forward to seeing you soon. Thank you so much.